Can you have a partial facelift?
A partial facelift.
Well, that's a tough question. We have tough questions today. It's unbelievable. I don't know. Like the face is divided, right? So we have the upper, middle, and the lower face and neck would include that. So when we talk about facelift, I think it's important to differentiate. Is it going to be a brow lift, which is really like the brow elevation to really take care of the wrinkle in the forehead. Other options would be in the mid-face, where we do a mid-face lift, and often those are combined with lower eyelid procedure. And then for the lower face, then often what people want when they ask us about that is they want to have like a jawline that they used to have when they were 20, 30 years of age. And so at that point is really like, a combination of facelift and also neck lift together. I don't know, that's the way I see that question. How about you?
Yeah, I think philosophically it's really important to think that to know that the face, all of it is aging. Now that said, there are some patients that just show that aging in a very concentrated area. I always use the analogy of a buffet as the surgeon. I feel like I'm laying out the various options, and then they get to walk through and just decide what they want to target first. And so,
But you could always come back.
Yes. Yeah. Yeah. Exactly. It's all you can eat, and you can come back whenever you want to. We love
Repeat customers.
We do. We like to think that our ourselves, our staff, and certainly our patients are like an extension of family and love those long-term relationships. And then that way, so that's the answer. Like, let's say if somebody's aging fully, but they just want to address one area, then I think that would count as a partial facelift. It may also be a partial result, but that's fine. If that's what the patient is looking for, and we feel confident that we can deliver that result, then by all means, it's a great solution.
Yeah, I think a lot of time people like come to us, and we see so many things, right? Like when we walk on the street, when people used to not have masks, we would see things, right? But what bothers us may not be what bothers our patients. So we want to make sure that we address what really brought them in, and so I think that's the key, right? And just make sure through pictures and discussion, and that's why we oftentimes like see a patient at least 2 times before surgery, because we want to make sure that we're really able to get the essence of what the problem is and be able to deliver a result that's going to solve that problem.
Yeah. And his point brings up a kind of a side question that I'll get asked a lot at like a party, a non-clinical setting, and somebody will sort of corner me and say, let me ask you about this thing. I'm sure it's obvious what I'm already going to ask. And it's not obvious to me, like I pledged early on to use our sense of vision and aesthetics for to help others, and so I'm not really thinking that
it's probably better not to answer those questions.
Yeah.
It's like, really?
So I love hearing where it's going, because I'm sort of like, no, I don't know what you're about to ask, but I love it.